So when breast cancer spreads, it likes to go to a couple different places. It likes to go to the brain, the bones, the liver, the lungs. Can you tell us a little bit about what brain metastases are?
Right, so brain metastasis really are tumor cells that have come from some part of the body. In the case of breast cancer, usually originally from the breast, although the cells could have migrated from breast cancer that's gone to the liver or breast cancer that's gone to the lung. But ultimately, those breast cancer cells land in the brain. And when they do that, they can either land in the so-called parenchyma of the brain, which is the actual brain tissue itself, and it shows up generally as, lumps or spheres in the brain, or it can land in the spinal fluid, otherwise known as the CSF, and that leads to something that we call leptomeningeal disease, which is cancer that is basically floating in the spinal fluid. And those are, even though they're both in some ways brain metastases or cancer in the central nervous system, they are quite distinct in the kinds of symptoms that people have and also in the types of treatments that we offer. But one of the common questions that comes up is, what's the difference between a primary brain tumor and a breast cancer brain metastasis? And the reason we care where the cancer came from is because the cancer keeps the characteristics of where it came from. So a breast cancer still responds to breast cancer treatments, even though if it's in the liver or the bone or the brain, and it's not going to respond to treatments necessarily for cancers that start in the brain or start in the bone. So that's why we put so much attention on the pathology, like where is this cancer from, because it really affects what we think about for effective treatments.
Thank you so much for mentioning that. As somebody with brain metastasis, I often find myself, describing to people what that difference is. It's hard sometimes for people to understand.
Right.
So that was a great explanation. How common are brain metastases?
Right. So for people who have early stage breast cancer, it's not that common as the first place for cancer to show up. So, for somebody who has either stage 1 or stage 2 breast cancer, less than 5% of the time will the cancer show up first in the brain. So that's a reassuring number if you have early stage breast cancer. For people who have inflammatory breast cancer, that chance is higher, probably like 10 to 15%. And for people who have metastatic breast cancer, at least when the metastatic breast cancer is first diagnosed, maybe about 5 to 10% of the time is there cancer in the brain. It's not any more than that. But over time, the chance can increase. And so for people who have HER2 positive breast cancer, for example, if we look from the time somebody is diagnosed with metastatic breast cancer to the time they die of breast cancer, over that period of time, about half of people will develop cancer in the brain. And similarly, if we look at patients with triple negative breast cancer that's already metastatic, somewhere around at least a quarter, and in some series up to half, but somewhere in that general ballpark of patients will develop brain metastases over time. It's actually less common in people who have estrogen receptor positive breast cancer. That's HER2 negative. In that case, the lifetime risk of developing brain metastases, even in the setting of advanced or metastatic breast cancer, is estimated at about 10 to 15%.
So you mentioned that when you receive your initial diagnosis of having metastatic breast cancer, that it's not as common to have it as a first sight when you're diagnosed. Why does it become more common over time?
We think that it probably becomes more common over time as people live longer, because it's almost like a chance happening. It's cancer has to break off, find its way into the blood vessels, get into the brain, figure out how to cross the blood-brain barrier and set up shop. And cancer cells are breaking off into the bloodstream all the time, but very few manage to do all of those steps. But the longer somebody lives with their metastatic breast cancer, the more time there is for these repeated attempts to be, I hate to use the word successful, but to make it to the brain. And so we see that, for example, in HER2 positive breast cancer, where many people survive more than 5 years after a diagnosis of metastatic disease, that's, I think, why we're seeing, part of why we're seeing an increased risk. But on top of that, HER2 itself probably has, and we don't know why yet, but there's some reason scientifically that HER2, from a biological standpoint, seems to allow cancers to get into the brain and set up shop there more easily. Because even people with ER positive, HER2 negative breast cancer, who also, very commonly will survive 5 or more years after a metastatic diagnosis, they're still at lower risk of brain metastases than patients with HER2 positive disease surviving for the same amount of time.